This is Dr. Bones, actually just his head. This is a plastic model that was cast from a real person's skeleton. You can think of it like a fossil that gives us information about his life. What I'd like to show you is how bone is affected by injury. If you look at his eye sockets, you can see that the left and the right look different. As I cover one eye and then the other, you can see different expressions. Happy or sad. The tops of his orbits are shaped differently, and there's less space for the muscles and nerves in the back of the left socket. This expansion carries over in the thickness of his skull in this area also. He was probably hit on the left side of his head at some point during his life, and his skull keeps a record of this. If you think about this for a minute, this is astounding. Nobody thinks about bones and tissues recording a list of life traumas, yet every skeleton I've seen has had these variations. Some of these changes are subtle, but others are obvious. Let's look at the rest of Dr. Bones' skeleton. Here you can see the right side of his sacrum is 5 millimeters larger, but the ischial tuberosity and the pubic ramus are larger on the left. A fall on the left buttocks may have caused this pattern. The left clavicle is a full centimeter larger than the right, and his left scapula is enlarged as well. You can see the distortion pattern in these left upper ribs too, probably the result of a fall on the shoulder. I bet he had a hard time being comfortable sleeping on that side. He may have also had trouble breathing or developed a heart valve prolapse. So, how do our bones change shape? When our bodies are impacted by an outside force, say a bat, or fist, or tree branch, or even the ground, the kinetic or moving energy of that fall or impact jolts the body. This energy can be diffused through the tissues to a certain extent, but once that force exceeds a certain threshold, glue-like collagen strands between the support structures of the bone uncoil, resulting in permanent enlargement of the bone. This undiffused kinetic energy is now stored as potential energy, or the energy of position or tension. In essence, the bones have lost some of the effect of their shock absorbers and have become more rigid and unforgiving. Once this happens, further injuries are more likely, as you've probably noticed. Your whole body is one big interconnected fabric, which science now calls a tensegrity matrix. It's kind of like this kid's toy. It has more rigid parts, like the bones, and more flexible parts like the muscles and ligaments. Every tissue and cell is connected to the ones around it, and as one is injured, the rest of the body now needs to compensate for it. The joints get stressed or misaligned. They feel like they need to be adjusted all the time. The shape of the bones change in the joint, and they don't fit together as well anymore. We might talk about it as carrying tension in our jaws or shoulders or necks or lower backs, or having a headache, a weak knee, or just needing a massage. But in many cases, the cause is impact-related skeletal distortion. Because everything is connected via the internal matrix, symptoms can sometimes show up in areas that are across the body from the original impact. You might have injured your left hip, and a while later, your right shoulder might start acting up. You might also get up from an impact and finish the game or go back to work thinking you're just fine. But then hours, days, or weeks later, symptoms will seemingly arise out of nowhere as the matrix redistributes this tension. Often these symptoms are musculoskeletal, but surprisingly they can include neurologic, digestive, or circulatory problems, or even mental symptoms. The organs themselves can be misshapen by trauma, or they can be stressed by having to function in a recently distorted skull or rib cage, or even a pelvis. The blood vessels, nerves, and connective tissues must stretch further now, which can lead to poor circulation, numbness, or tingling. This can be confusing if you don't understand how all these things are interconnected. The exciting part is that much of this damage can be reversed through matrix repatterning. With gentle, precise pressure, which we turbocharge with a biocompatible magnet, we start a piezoelectric effect. This begins to release the tension the bones and dense organs are holding onto and allows the collagen fibers to regain their original shape and resilience. This process changes the overall tone of the body and allows everything to relax. The body is encouraged to revert to its original factory settings, or how your DNA blueprint designed them to be. Even the cell membranes relax, allowing them to absorb nutrients and eliminate wastes more easily. This cutting-edge approach to healing is so powerful. I've seen tremendous results from this work, and I'm thrilled to be able to bring it to you. Most people get off the table feeling so much lighter, like there's more space in their bodies, especially their heads, their necks, their rib cages, and their pelvises. Their joints loosen and old injuries they thought they'd never be rid of disappear. Often headaches stop. Jaws, lower backs, and pelvises stabilize. Shoulders and knees move better than they have in years. People stop snoring. Bladders and uteruses work better. People feel happier and more relaxed. They think more clearly and feel less stressed. I see these changes all the time in my patients, but still it feels magical. If you'd like more information, you can contact my office at incarnatechiropractic.com or check out matrixrepatterning.com.